Lack of libido is more common in women than men, but it significantly affects both sexes. In fact, research shows 32% of women and 15% of men lack the desire to have sex regularly. Whether you're on the lower or the higher end of the age spectrum, a low libido can strike at any time in your life, and for a variety of reasons, including low testosterone, depression, stress, relationship issues, sexual dysfunction, prescription medication, being overweight, too little or too much exercise, sleep apnea, and drug and alcohol use. Naturally, people wonder how to increase libido. If you've little to no sex drive, you're definitely not alone. But the great news is there's lots of natural remedies to increase the libido, and you can start increasing your sex drive today. If a higher sex drive is your goal, then it's time to make a significant lifestyle change. For instance, decreasing your stress levels, improving your sleep, adding more natural aphrodisiacs to your meals, and exercising the right amount to put your mind and body into a libido-encouraging state. Libido is defined as a person's overall sexual drive or desire for sexual activity. Low libido in women and low libido in men have some similar roots, along with some gender-specific ones. For men, it's actually quite normal to have a gradual decrease in libido as a man gets older. Each man is different, but most men tend to have some amount of sexual desire into their 60s and 70s. If aging isn't at the root of the libido decrease, a man might be depressed or be experiencing too much stress. Other possible causes of low sex drive in men are medication side effects, a decrease in male sex hormones due to an endocrine disorder, or sleep apnea. A little to known fact is that sleep apnea can lead to unusually low testosterone levels. Low testosterone can also cause erectile dysfunction, a condition where a man can't get or maintain an erection. While both issues might involve low testosterone, erectile dysfunction and low libido don't necessarily equate or even happen at the same time, although they're thought of as common comorbidities or co-current conditions. Low libido is actually more common in men with premature or delayed ejaculation than it is in those with erectile dysfunction. Men who have a hard time getting or maintaining an erection often have a normal or even high sex drive. When it comes to a low sex drive in women, there can be many causes. According to sex psychologist Cheryl Kinsberg, women's sexuality tends to be multifaceted and fairly complicated. Common causes of a loss of sexual desire and low libido in women can include issues in the relationship with the partner, socio-cultural influences, job stress, media images of sexuality, etc., and medical conditions like fibroids, endometriosis, and thyroid problems. Low testosterone doesn't just cause sexual issues for men. Women can also experience low testosterone. Female testosterone levels peak in their mid-20s and then steadily decrease until a woman goes through the menopause. After menopause, female testosterone levels drop dramatically, and sex drive can drop dramatically as well. Birth control pills and other forms of hormonal pregnancy prevention can also have negative effects on a woman's desire for sexual activity. When it comes to increasing your libido, there's two key biological chemicals that can affect your levels of sexual desire, whether you're a man or a woman: dopamine and prolactin. It's theorized that dopamine increases desire, while prolactin decreases it. If you take any medications, it's important to know that some of these can increase prolactin release or can inhibit dopamine release. Either of these two scenarios can decrease sexual desire and also cause other sexual side effects. In men, low prolactin has been linked with multiple signs of poor sexual health and psychological health. Low prolactin levels are also associated with a larger body mass index, higher blood sugar levels, lower levels of physical activity, and just generally feeling unhealthier. Relationship issues, depression, prescription medication, alcoholism, drug abuse, and chronic diseases like diabetes can all be at the root of low sex drive for both sexes. A BMI that's too high can cause problems for both men and women when it comes to libido. Obese men tend to struggle with erectile difficulty, but studies have shown losing only a small percentage of weight can improve both male and female sexual function. A study conducted at Duke University reports obese people are 25 times more likely to report sexual problems. Collagen-rich foods. Collagen production naturally declines with age. This has a direct negative effect on skin health, and it makes it harder to keep skin firm. This phenomena can make it harder for men to maintain an erection, and it may lead to a looser vaginal wall in women. To increase your collagen levels, you can consume more bone broth and opt for a collagen supplement and a protein powder made from the bone broth. Vitamin C also helps to increase collagen production. Typical doses are 10 to 15 grams of collagen per day. In 2008, research conducted at Texas A&M demonstrated watermelon can have a Viagra effect. The phytonutrients known as lycopene, beta-carotene, and citrulline found in the watermelon help to relax the blood vessels. While watermelon might not be as organ-specific as erectile dysfunction drugs, it can be helpful in the bedroom without any negative side effects. Eating bananas can help to increase female hormone levels that improve sex drive according to animal research. Spices are loaded with antioxidants. They're great for the overall health, including libido. Research published in the journal BMC Complementary and Alternative Medicine found that extracts of nutmeg and clove enhance the sexual behavior of male animal subjects. Clove is also great at improving bad breath. Saffron, on the other hand, can help to improve sexual dysfunction in females who are on antidepressants, as well as men with erectile dysfunction. Research has shown chocolate consumption leads to the release of serotonin because of its tryptophan content. This can lead to some aphrodisiac and mood-lifting effects. Just make sure you have low sugar, high-quality dark chocolate. Brazil nuts are high in selenium, and this plays a role in maintaining healthy testosterone levels. It also helps your body's serotonin production, similar to dark chocolate. High-quality protein is also high in tryptophan. Protein-rich foods like eggs, wild-caught fish, pasture-raised poultry, and grass-fed beef and lamb can help to increase serotonin and boost your mood and libido. Maca root is an adaptogenic herb. It's popular in traditional medicine practices as a sexual stimulant. The maca consumption results in both increased sexual desire and decreased sexual dysfunction. It may work in as little as 2 weeks to improve libido in healthy men, with the added bonus of a boost in exercise performance. If you don't live in an area where the maca can be purchased in whole food form, you can purchase it as a supplement. Available in herb and essential oil form, fenugreek helps to increase the desire for sex, particularly in males. The treatment with fenugreek can significantly improve libido and sexual pleasure ratings, as well as regulate poor testosterone levels. Fenugreek leaves smell somewhat bitter, but they're delicious when cooked. Making sure you're not dehydrated is helpful when it comes to libido, since dehydration can cause a number of negative side effects, and these can easily dull your sexual desire. If you want to avoid possible fatigue, headaches, and vaginal dryness, then drink more water. As processed foods have made up more and more of the standard American diet, obesity has been on the rise. Overall, the BMI of the American population has gone up at least 10 to 14% since the 70s. Since obesity is so closely tied with low libido, you should remove as much processed foods as possible from your diet and replace them with whole, less processed options. While a lot of large-scale scientific evidence doesn't exist due to the nature of the problem, many natural health practitioners are concerned with the hormones used to treat non-organic factory farm meat, and that this might interfere with your normal hormone production. You should avoid processed food and opt for organic whenever possible to support the libido. Foods that are high in sodium, like canned food and processed food, can contribute to high blood pressure, and this can decrease the flow of blood to the sex organs. Make sure to use a natural salt like rock salt or sea salt. Like factory farm meat, conventional dairy is considered to be healthier by many organizations. However, milk, cheese, and other dairy products from cows can have synthetic hormones known as phthalic acid esters, or PAEs, and these have a negative effect on estrogen and testosterone levels. Sugar in general negatively affects sex hormones. Studies have shown specific and concerning impacts on testosterone levels. In a 2013 study of male subjects, the consumption of glucose decreased the blood levels of testosterone by an average 25%, regardless of whether the man had diabetes, prediabetes, or normal glucose tolerance. Testosterone levels also remained low hours after the glucose consumption. It's a bit tricky when it comes to caffeine, but it's best not to overindulge if you're experiencing libido issues. During athletic performance, a small amount of caffeine can moderately increase testosterone, and this can indicate positive effects on sexual performance and drive. However, this increase might not actually be that helpful, because the caffeine also increases cortisol. This has the potential to induce stress, and this then further lowers libido. Coffee and tea can be a great addition to a healthy life, but keep it under control and avoid caffeinated products at least 6 hours before bed. Overdoing it on alcoholic beverages is known to decrease sexual desire, arousal, and sensitivity. If you're going to go drinking, opt for 1 glass of a polyphenol-rich red wine. The antioxidants in the red wine can help to widen blood vessels and increase blood flow to key arousal areas. It might be convenient, but it's certainly not healthy to eat popcorn. The chemical found in the lining of microwave popcorn bags, as well as in non-stick pots and pans, has been linked to lower sex drive for men. According to a 2009 study, these type of popcorn bags contain PFOAs and PFOS, known to significantly lower sperm count. Some supplements for men with low libido. Ginseng at 1,000 mg per day. Both Asian and American varieties of ginseng seem to positively impact the nerve function and the central nervous system's activity to boost libido. Tribulus terrestris at 250 to 1,000 mg per day. It's been used in traditional Chinese medicine as an aphrodisiac. Research shows Maca helps to increase sexual desire. The velvet bean, or Mucuna pruriens, helps to reduce stress, particularly in infertile men, and it causes antioxidant activity to increase libido. It also increases dopamine levels. Yohimbe, or Yohimbine hydrochloride, is commonly used as a remedy for sexual dysfunction. The bark of the Yohimbe tree can encourage relaxation of the smooth muscles, and this can help to counteract erectile dysfunction, and it can improve sexual performance. Gingko biloba at 200 mg per day can help men on antidepressants. It can help through the 4 phases of sexual response: desire, excitement, orgasm, and resolution. Supplements for women are Panax ginseng at 1,000 mg a day. This has been shown to increase sexual desire in women throughout the menopause. Research shows Maca helps to increase sexual desire in both men and women, particularly if low libido was induced by psychotropic drug use such as antidepressants. If you have iron deficiency anemia, supplementing with iron can help your libido. Look for an iron chelate, which is generally well absorbed, and take it with vitamin C. Iron supplements can cause constipation, therefore it's important to confirm that your anemia is being caused by an iron deficiency by taking a blood test. Using ashwagandha in supplement form can help women to treat female sexual distress. Ginkgo biloba is particularly effective at treating antidepressant-induced sexual dysfunction in women, with a 91% success rate in one clinical trial. For more information, you can check out my website and see videos on reducing stress, improving sleep, and treating other female conditions such as endometriosis or infertility, as all these can naturally help to increase your libido. To learn more about herbs, supplements, and natural treatments, or to book a consultation, check out my website.